According to the Ghana National Ambulance Service, the country has 291 ambulance service stations countrywide. However, these services are urban-centered, making it difficult for rural folks to have access at critical times. This leaves rural dwellers, particularly pregnant women and children who need emergency medical care, to be transported on motorbikes, bicycles, and commercial vehicles, and this sometimes results in maternal deaths. Rukaya, a resident in the Gushegu municipality, recalls how her husband put her in a commercial vehicle when she was in labor.
Mama na jiyon operation buiza karnang ma. Demin da kane operation ma ranyela maso hal lor ma trata kwang na yikuliya lor ma ya tuama drata nan kabiya nan operation ka zang la ka lor ma zang la so chang ambulance ma zang la so chang shelpulo yi dan da bo lor so da lor kar zang ma chang hospital ma tan mo operation.
In a bid to provide an emergency referral centers for rural communities, the Calic Relief Services, an NGO in collaboration with National Ambulance Service and its partners with funding from the USAID, has established an emergency dispatch center in the Gushegu municipality to respond to emergency calls from rural communities and further dispatched a modern motor ambulance to convey patients to the nearest facility. Here is the Deputy Director in charge of IT at the Ghana National Ambulance Service, Edmond Boatin, explaining further to Citi News how the center operates.
The purpose of this center is to coordinate referral activities between the CHIPS compounds, the district hospitals, modified motor tricycle ambulances, and the national ambulances fleet. So basically we receive calls. If we need to give some online medical assistance, we do that. And then depending on the case or severity of the case, we dispatch either a modified motor tricycle ambulance, which we call the MMA, or an ambulance itself to go and then attend to that. So basically what we do here is a set of coordinating activities between the health facilities, the MMAs, and the ambulance service.
Speaking at the commissioning of the Emergency Dispatch Center, the U.S. Ambassador to Ghana, Her Excellency Stephanie Sullivan, said the ability of a pregnant woman to receive timely health care is key to reducing maternal and neonatal deaths in rural communities. She described the center as a central nervous system for emergency referrals.
Pregnant women can now recognize the 3 most common pregnancy danger signs, which are bleeding, headaches, and swelling of the feet. An important link in this chain of services is emergency care. Once a woman and her family recognize a danger sign, they need to access safe, reliable, and timely transportation. This dispatch center, it's the central nervous system for emergency referrals, the interface between the community, the ambulances, and the health facilities. The United States provided support for this approach. And this innovation is a result of a partnership between the Ghana Health Service, the National Ambulance Service, district assemblies, and community members.
The country rep for Calic Relief Services, Daniel Mumuni, noted that the acute care and emergency referral project has so far made significant impact in saving lives.
An emergency dispatch coordination center further strengthens the system even more. Even as we launch the second phase of the referral component, I am pleased to state that ACES has coordinated the referral transport of 2,744 emergency cases, averting negative outcomes, including deaths. And the last component of the project, which is the quality of emergency obstetric care. CRS has supported capacity building of 185 health staff and 542 community-based agents to support the delivery of maternal and newborn services.
For Citi News, I am Dinah Ngwan, Gushegu.